Hello, and welcome to the Primary Care Access Improvement question and answer session. My name is Jennifer Major, and I'm a Senior Program Lead at Healthcare Excellence Canada. Before we get started, I'll review the technical components for today's session. First, the session is being recorded. Second, portions of the session will take place in both French and English. As such, we're pleased to offer simultaneous interpretation. Please choose the language you wish to listen from the interpretation menu. If you do not see the interpretation menu on your Zoom toolbar, you can look across the bottom of your screen and select the More button or the button with 3 dots. And there you'll be able to select if you'd prefer to listen in French or English. If you wish to hear whatever language is being spoken, so if you're okay to listen to French or English, you can simply leave the interpretation set to off. Third, we invite you to share your questions and comments at any point using the chat box in either French or English. We will have a dedicated question and answer segment, but we'll also answer questions in the chat as we go along. Finally, if you need support at any time during the webinar, reach out to tech support using the direct chat feature. So this session is being hosted in Ottawa, which is traditional and unceded territory of the Algonquin Nation. I recognize and deeply appreciate their historic connection to this place, and I'm thankful for the opportunity to gather here today. So the photo you see there shows beautiful tulips at the Ottawa Tulip Festival that I saw a few weeks ago. I invite you to introduce yourself in the chat and let us know the lands that you're joining us from today. So imagine a future where everyone receives the right care at the right time in the right place, where more people can access primary care when they need it, and where the emergency room is not the only way to access care for issues that can be managed in primary care. Imagine a future where more people can age at home with dignity, and long-term care is compassionate and tailored for those who need it, where the health workforce is supported and leading the way forward. That's why Healthcare Excellence Canada is inviting you to join Care Forward, a pan-Canadian movement of people making healthcare better, faster by sharing knowledge and applying proven approaches for high quality and safe care. So Care Forward focuses on 4 key priorities that you see in the yellow section of the slide: expanding access to care and easing pressure on emergency departments, helping more people age where they call home, advancing safe, person-centered and long-term care, and supporting the health workforce. So in today's session, we will primarily discuss the primary care access improvement offering, which primarily reflects the Care Forward priority you see here: expanding access to care and easing pressure on emergency departments. The overall Care Forward program offerings are guided by 4 key policy pathways that HEC has identified that can help ease pressures on emergency departments. The 4 key pathways include supporting community-based health promotion and disease prevention, expanding access to primary care, enhancing appropriate care through service integration and innovation models, and strengthening the health workforce. So this slide shows the names and overall objectives of the 4 new offerings under Care Forward within that expanding access to care and easing pressure on emergency department pathway. So Right Care Challenge is a 12-month program for organizations who are actively engaged in making improvements to expand access to care and ease pressure on emergency departments. Health and social organizations at all stages of their quality improvement journey can join, including those who have recently identified a need, have conceptualized a solution, or have already initiated implementation. Through the challenge, there's over $900,000 in prizes available to teams, whereby a single team could win as much as $34,250 if successful across all the 6 award opportunities. We're also pleased to partner with the Graham Beck Foundation, who will provide support to integrated youth services teams with an available 5 awards at $10,000 each. Participating teams will have access to virtual learning, coaching, and networking activities to help advance unique healthcare improvement initiatives to ensure patients receive the right care at the right time in the right place. Enhancing Integrated Care is a 12-month offering that will bring together up to 100 primary and community care organizations. Teams must be actively engaged in starting or advancing team-based models of care that have potential to reduce pressure on emergency departments and expand access to care. Teams can be based in primary care settings or in a setting connected with primary or community care. So, for example, hospitals, home care, mental health, palliative care. By participating in enhancing integrated care to advance your work your organization is already doing, your team can receive up to $10,000 in seed funding, coaching sessions, and get advice from experts, as well as participate in virtual learning and networking opportunities. Paramedics and Social Prescribing is an 18-month offering to support paramedic services to improve and further embed social prescribing in their service models. Eligible applicants can include public or private paramedic service organizations in Canada. Teams in the planning, implementation, sustainability, or spread phases of embedding social prescribing within paramedic services are welcome to apply. Selected teams in that program offering will receive seed funding, group coaching calls, resources, and virtual and in-person learning experiences that foster peer connection and knowledge development. And of course, the offering we're going to focus most on today, the Primary Care Access Improvement Program, will support team-based primary care organizations to create efficiencies and optimize team functioning so they can improve timely access to care for patients and improve work experiences for the primary care team. So I want to acknowledge the 27 supporting organizations for joining the Care Forward Pan-Canadian movement to help HEC drive change across the country and for committing to common healthcare goals. Specifically for the Primary Care Access Improvement offering, HEC is also discussing opportunities to collaborate with Fonds de Fédération de Médecine en Praticien de Québec. Fonds FMOQ has committed to advancing advanced access in Quebec, and therefore part of this collaboration would look to see how Fonds FMOQ and HEC could work together to support Quebec teams. For example, coaching provided by Fonds FMOQ, who will work with HEC's coaches that are supporting all teams across the country. So, Primary Care Access Improvement is an 18-month offering that will support 25 team-based primary care organizations implement contemporary advanced access. Advanced access is a widely endorsed quality improvement model that enables patients to access primary care services when they need it while ensuring continuity of care. It achieves this by creating efficiencies and optimizing team functioning in primary care settings. The offering is based on work led by Isabelle Gaboury, Milan Breton, and others from the University of Sherbrooke, and the offering is also based on the Increasing Efficiency to Improve Access to Care Learning Collaborative by the Alliance for Healthier Communities in Ontario. Lori Zager was the main coach for that program. Isabelle and Lori are both joining me today on this call and will help answer questions during the question and answer period. So expected outcomes for the teams in this offering include improved timely access to care for patients while ensuring continuity, and improved provider work satisfaction and team collaboration for providers and administrative staff. For example, administrative staff may experience less stress if it's easier for them to book appointments with patients when they need to. The PCA offering, the Primary Care Access Improvement offering, was designed over about the past year, primarily by Healthcare Excellence Canada and a small group of subject matter experts, including Lori Zager, Jennifer Rayner, Milan Breton, and Isabelle Gaboury. So thank you to the work of that working group. So, who can apply? Eligible organizations include primary care clinics or organizations that deliver team-based primary care. Team-based primary care involves health professionals of various disciplines working together to provide care for patients. Additional eligibility requirements and selection considerations include what you see on the slide. So, a committed team, including an executive sponsor, a team lead, and a measurement lead. This core team would meet several times a month with an assigned coach, and teams will work with the coach to plan, test, evaluate organizational changes to embed advanced access. A clearly identified challenge or problem that advanced access can help solve. Because this offering aims to improve access and wait times for patients, the offering is meant for organizations that have a challenge with wait times that they want to improve. Commitment to collect and share data to guide improvement, including a measure of patient wait time called third next available appointment on a weekly basis for all or most of the providers in the organization is also a requirement. And commitment to collect and share data to inform HEC strategy, including the number of individual patients or clients who received care at the team's organization clinic while participating in the HEC offering, which would be collected and reported quarterly, and the number of emergency department visits patients avoided because they were able to receive care from that team's organization or clinic. So HEC will work with each team to determine the best approach to obtain this information following invitations to join the program. So, what is advanced access and how will teams be supported to implement it in their primary care organizations through the primary care access improvement offering? So, with support of dedicated coaches, teams will learn about and embed organizational changes needed for advanced access based on the 5 contemporary pillars of advanced access you see on the slide here. Teams will identify the top areas for improvement or changes they see critical for enabling advanced access in their unique setting. So each pillar identifies an area of work that's necessary for successful implementation of advanced access. So for example, one of the 5 pillars focuses on helping healthcare teams balance appointment availability with patient demand so patients can get timely appointments without long delays. Other strategies coaches may support teams to test include reviewing the appointment system to help them apply strategies to open more next day appointment slots or appointments within 48 hours. Coaches can work with teams to help them optimize the roles of each provider on the team. So it makes it easier for patients to have appointments with the provider who's best positioned to respond to their needs in the most timely manner. So in the chat, you'll find the link to a 2-page backgrounder describing the 5 pillars of contemporary advanced access that the primary care access improvement teams will consider and apply closely with coaches. So this slide shows the 7-step improvement journey that coaches will take with the teams invited to join the program. So again, with an assigned coach, teams will create and iterate an improvement charter to describe the challenges they're experiencing with access and the opportunities they see for improvement. Step 1, you'll see the teams will identify the problem, the opportunity for improvement related to access. If you go to step 2, they'll work to build an improvement team to inform and actively lead the work to improve access. An executive sponsor, team lead, and evaluation lead is required on the application, but coaches will support the teams to add additional people to that improvement team once they join the program. Based on the unique challenges and opportunities for improvement, that teams will develop aim statements, establish measures, and test change ideas through plan, do, study, act cycles using improvement data. And the coaches will support teams to implement and sustain change ideas that ultimately improve access for patients as well as experience for providers. So as just one example of successful implementation of advanced access, using this coaching support model that primary care access improvement offering will involve, after just 6 months of implementing contemporary advanced access with support from Healthcare Excellence Canada, Isabelle Gabory, Milan Breton, and team based out of University of Sherbrooke supported 4 clinics in Quebec to achieve the following results: improved access to team-based primary care, with appointment wait times reduced by an average of 7 days, more appointments available within 48 hours, and better provider experience, with providers reporting reduced workloads, fewer administrative tasks, and higher job satisfaction. So you can find a 2-page summary of what I've just described on Healthcare Excellence Canada's website, and probably in the chat. So this slide shows the offering benefits. Teams will get or be eligible for up to $15,000 in seed funding, in addition to that dedicated coaching support that I've already described. Opportunities to connect with others, to share, learn, and celebrate successes together through virtual and in-person learning activities, and opportunities to raise the profile of your team and the ongoing work through HEC's newsletter, website, social media, and networking opportunities. So this slide shows the timeline for primary care access improvement. So the applications are open now, and they're due by June 27th. Applications are to be submitted online through HEC's community portal, which we'll put the link to that in the chat. You do not need to complete the application in one sitting. You can start it, return to it anytime before it's due on June 27th. And we do encourage you to start it soon so that if you're interested to apply, we can help answer any questions you may have along the way. So starting next week, we'll start to reach out to teams who started an application so that we can offer our help if that's useful. Applicants would be notified by July 31st, with signed agreements due back to Healthcare Excellence Canada by August 27th. And the program activities start in September and run for 18 months until February 2027. So in terms of the activities, we have a document that shows details about the activities and deliverables, which we'll put in the chat. The main activity for this program is coaching. So each team will meet with an assigned coach or a small group of coaches 2 to 4 times a month virtually, with the potential for 2 in-person coaching sessions. The coaches, again, help the teams navigate that 7-step improvement journey I reviewed earlier to consider and apply the advanced access within their settings. There will also be 5 webinars that will convene all teams to promote sharing, learning, and networking. And we'll host other virtual activities and quality and safety topics throughout. The key deliverables include, on September 10th, all staff within the team's organization will be asked to complete a brief electronic provider experience survey. It'll take about 20 minutes to complete, and the survey will be completed again in February of 2027, so at the end of the program. And that's meant to assess the improvement that providers in your team may have experienced following their participation in the program. In addition, on September 10th, coaches will work with the teams to obtain the current baseline measure for third next available appointment for each of the providers in the team's organization. Third next available appointment is the sum of the days between the time a patient requests an appointment and the time of the third next available appointment for any patient. This measure is to be collected weekly by teams with support of the coach and for all or most of the providers in the organization. On December 15th, that will be when the first reporting on the HEC strategy items happens. So that will include the number of individual patients or clients who received care at the team's organization while participating in the program, as well as the number of emergency department visits that patients avoided because they were able to receive care at the team's organization. And as I mentioned, HEC will provide each team with support on how to collect that very easily. On January 16th, there's an improvement charter that teams will be working throughout the program with their coaches on. And you'll share that with HEC just so that we can, the coaches can understand and share the learnings across the teams. And we'll profile these learnings if the teams are okay with that in some of our webinars. And in February, there's some final reporting, an online final report and final survey. So the next slide shows you just some summarized information, much of which I've already touched on. So just some more what I've mentioned about the overall eligibility, the offering activities, as well as important dates for the application. So as I mentioned, and maybe worth repeating, the applications are now open until June 27th, and they're submitted through an online portal, which you can find the link to in the chat. Shortly, I'll provide you with an opportunity to view a short video that demonstrates the application process. And as noted previously, you do not need to complete your application in one sitting, but the earlier you start your application, the earlier HEC can help answer any questions you have while you're completing it. And that the same goes for the other 3 offerings that I reviewed earlier in the call. All right, so now is the time for the question and answer. And during my overview, I have not 100% looked at all the questions, so I'm going to do that now. But maybe before I jump into that, I did mention that Isabel Gabri and Lori Zager are on the call with me. And so I thought, because they're both coaches for this program, so you'll have an opportunity to work with them if you're part of this offering. I just thought maybe I'll ask Isabel first and then Lori to reflect on a question while I pull up the other questions. So maybe first to you, Isabel. So through the primary care access improvement offering, teams will work with coaches to identify changes they want to test to improve timely access for care. So can you share an example change you've seen a primary care organization have success with?
Sure. Hi, everyone. And I could say that I'm going to be able to take questions in French also if you are from the Francophone group. So, and this is interesting, Jennifer, because there was a question in the chat about that, like, are we imposed solutions, or are we imposed like one size fits all solution, that I like to call? And the answer is no. So we are taking a very pure quality improvement approach, which means that, yes, we do have some solutions. Laurie and I have coached more than almost 60 clinics over the course of the last 5-7 years. And so we do know that some change ideas works better than other, but we also know that in order to be sustainable, a change idea has to be adapted to your clinic, to your context, and sometimes what works at the clinic next door won't work for you. So and this was my answer, you're in the driver's seat. So for example, what we like to implement is an orientation algorithm. So we have plenty of examples of orientation algorithms that work, but we know that we have to customize them to your clinic's way of functioning and according to the principles of advanced access. So this is what the coach will do with you, making sure that the solution is very well customized to your clinics and your ways of functioning in order for you to have a better access for your patient.
Thanks, Isabel. So yeah, you'll get a lot of opportunity to work closely with that coach who will meet you where you are and make sure that those solutions fit your setting. Um, Lori, do you have any reflections to that? Change ideas you've seen work really well with the clinics you've helped to implement advanced access?
Sure. Hi, everyone. Really nice to be here. Looking forward to working with the teams that join. Yeah, I mean, and thinking about some of the work that the teams do, I often see that it's often the small changes that teams make that can have a big impact. So we often talks about big change initiatives in our healthcare system, and sometimes it's the little things that people do. One of the things we call, combing the schedule, keeping the time commitment to that really, really small, but it can have a big impact. We're a provider, and either can do it by themselves or with their admin team, and they just start looking ahead in the schedule to see if there's things that can be doubled up or done differently. And those kind of small ideas can have a big impact. So that's the kind of thing that you'll test out in the program. But as Isabel said, it will all be driven by what your team wants to do and what is the specific nature of your practice.
Thanks, Lori. And I know we're also getting a lot of questions about, people really excited to learn more about how, the impact for the providers in the clinics and the primary care organizations around, the reduction they feel in their workload, the administrative burden, and the higher job satisfaction. And I guess there's a question about people wanting to know the approach you take to measuring that. So I did talk about in at least primary care access improvement, we'll do a pre-survey and a post-survey of the providers, and we often do focus groups to really understand the impacts that they're seeing. But Isabel, Lori, any experience from you that where you've seen that improvement from the provider side and the administrative assistance that you'd like to share and how you went about measuring that?
Yes, so one thing that we've observed, so we're using some measures, like for example, one of them is the mini Z. It's 3 questions measuring burnout level in the clinic. But 2 observations that we've made through the course of the coaching we've provided in Quebec and New Brunswick is we've observed less turnaround from the admin assistant staff, definitely in the clinics that have been with us for 12 to 18 months, like that have done the full coaching. And also a citation that I really like, there were 2 physicians from 2 different clinics that told us, "You've given me air." So which is for me a good illustration that they felt like really burdened by not being able to offer adequate access for their patients, and they feel less stressed and much like they thought that their work was much more enjoyable at the end of the training or the coaching, I guess they got from us.
Thanks. Lori, anything for you to add? Like
Yeah,
anything?
I must admit that when we started the Learning Collaborative at the Alliance in 2023, I, as a coach, was extremely worried about this issue because, post-pandemic providers were so burdened and feeling overwhelmed and burnout. And when we did our meet and greet with the teams, that's what they wanted. They wanted the teams to feel better. They wanted the providers to feel better. And I was like, oh my goodness, like how can we deal with that? It's such a massive issue. But we worked with the teams, and I must admit that it surprised me. It also was extremely rewarding to see the teams by the end of the collaborative, the providers self-reporting, exactly like Isabel said, like they feel better. I feel like I have more agency over my day. I feel like I can, I can breathe. I remember one particular meeting where a team, kind of put their work to the side, which is totally fine too, and had that big discussion about it. I wish I'd recorded it in the end. And we have some recordings of teams talking about how they feel. So we don't have, hard data like Isabel's talking about, but as an experience as a coach, I must admit I went from being terrified of that to actually feeling that the work really helped.
Thanks, Lori and Isabel. And yeah, at Healthcare Excellence Canada, certainly we see the value and importance in the stories that we hear from the people who are, impacted by this. So the provider stories, the patient stories, the stories from the admin assistants. And I know I did hear from another provider that when they implemented advanced access, that person experienced less stress because they knew that their patients could get follow-up appointments when they needed them, and because they didn't have to double book or take time over breaks to see patients that they knew really needed to be seen. So I think kind of speaks to that, the air that they got, like they could breathe in their day and actually take breaks to recharge in between patients, et cetera. So yeah, definitely have heard lots of those. And we can continue to kind of talk about the different ways we can capture those stories, and there may be quantitative ways to do it as well. But yeah, thank you for those questions, and it's certainly an important impact of the advanced access work. So I'm just looking at I see there's been some talk in the chat around the EMR pieces that I think, Milen, you're answering, so that's great. There's a question about TELUS EMR, and I know that Isabel, Milen, and team have worked with TELUS EMRs. You can correct me if I'm wrong on that, Isabel. But let's see. So there was a question about the 2-question survey around the ED, the emergency room visit data that HEC is looking to collect for our strategy. And so the patient survey is given to a group of patients who receive care or support through through the team's initiative. So while they're working in the program. And it can be given on paper, digitally, or verbally. Like I mentioned, we'll schedule meetings with all the teams once they're invited in to make sure that we help them determine the best way for them to issue that survey. And the survey is just 2 questions. So, whether a patient avoided visiting an emergency department because they were able to get timely care at the team's organization or primary care clinic, and just a yes or no. And the teams have to just let HEC know how many yeses they got and how many no's. And we are going to hold your hand through that process. And so it shouldn't hopefully be burdensome for you. Okay, so there's that question. And then there was a question, I'm interested to know how coaches would support teams on how better to serve patients and families with limited English or French proficiency. So really good question. Once we get the teams in, and if we understand that there's different languages of the team that need to be considered, then, I think we can figure those things out at that time. So make sure we have a coach who could support a successful team to participate. So maybe that is like through a translation that we could get in place, etc. But if you have any the person who asked that question, if you have any specific questions that you'd like to, like specific languages or issues that you're thinking about, don't hesitate to reach out directly, and we can certainly make sure that we answer the question for you and support you to apply. All right.
Jennifer, there was a
Go for it,
question
Isabel.
from Tricia that I really liked. She was asking if we're part of a large FHT, can only a portion of the FHT apply? Yes. And in fact, we would be working with only the portion or the small clinics because we really work with a team that is connected and that functions similarly. So if your FHT is located in 5 different sites, most of the time you'll have different ways of working. And so we want to work with a single system at a time. So totally possible, Tricia, to apply as a portion of the FHT.
Thanks, Isabel. Okay, so another few questions that came up. So 2 questions. Are the coaches included in the application grant? No, the team, when you're putting your application together, you don't have to request or include a coach. HEC already has a group of coaches who are going to support this program offering, and we're going to pair the successful teams with coaches once we get all the applications and etc. So no, you don't have to do that as part of your application. A second part of that question was the money we receive. How is it to be used? Or can you give us examples of what it could be used for? So typically the eligible funding is up to $15,000. It's often used for staff replacement for those staff members to participate in the initiative, like in the program offering. So for example, there's the 5 webinars and there's the coaching. The virtual coaching takes place 2 to 3 times, even 4 times a month. And so for a team lead, an executive sponsor, and a measurement lead at minimum to go to those meetings, you can use the seed funding to fill in for the person who's essentially to compensate those people or backfill those roles as the other individuals are participating in the program activities. So hopefully that helps clarify that. I'll also say that in the call for applications, I believe it's the last page of the call for applications, there's a table that goes through eligible and ineligible expenses. So take a look at that if you have any specific questions at all about what might be eligible or not. But that is typically what a lot of the funding is used for. If you're a multi-site clinic, so imagine if you may have some travel costs to collaborate with different team members, for example. So as long as it's part of that, your work in the primary care access improvement offering, then that would be also eligible. Any other questions you see there, Lori or Isabel, that you'd like to take?
Question from Zabi, who's asking about the in-person sessions and the virtual sessions. So the coach will guide you, and okay, the very first in-person session, we'd like everyone from the clinic to be there because we think that improving advanced access is a sport, a team sport. So it's important for us to have everyone there, and so everyone is aware of the problems and the initiatives that we're trying to improve. But then the coach will guide you and will form an improvement team that is like a small team of 4 or 5 people. And the coach will sometimes meet on only one person or the improvement team only, but the coach will guide you as you need and towards the improvement process. So I don't know if it answers your questions, Abby, but we're really sensitive to the fact that you're already really burdened and stressed out, and don't worry, it's not gonna like increase that much the number of meetings that you're having in a week or a month. We're really sensitive to that.
Mm-hmm. And I'll also say that as teams are invited in, we'll work very closely with you over the summer to figure out who needs to be at those meetings, make sure it's scheduled at a time that works best for your staff, etc. And yeah, so there's a lot of support, at least hopefully to help with the scheduling and really clarify who needs to be there and what the agenda is and all that. It's a very collaborative process. Anything else you see there?
I was just going to reply to Laura's question around a small CHC in southwestern Ontario where providers have both in-office visits and outreach days. And so would that work within this program? Absolutely, yes. I mean, that's just an example of a schedule. And that's exactly the work that needs to be done, is fitting this kind of work. What do we look at in terms of the schedule you currently have, and how do you make changes to that schedule to better fit demand, that kind of thing. So absolutely, that would be something that you'd work within, knowing that you don't want to get rid of outreach days. It's really important, but how do you use that to balance your demand, your supply and demand?
Okay, thank you, Lori, and keep the questions coming in. So I had a question there. Any insights on eligibility or impact on readiness assessment for rural sites with smaller interdisciplinary teams? So I will say that at least from the selection considerations that Healthcare Excellence Canada will have, we certainly want to have teams that represent from across Canada and also types of communities within Canada. So we certainly would love to see some rural, remote clinics, sites, teams come in. But just wondering if Isabel, I know you've worked with some rural or smaller sites in Quebec, but did you have any insights on readiness that those smaller sites might have?
The size of the clinic doesn't really matter. What matters most is you have to make sure, and you'll sense some of that in the application form, but we want to make sure that you get at least 50% of your people on board for this QI initiative. So we found that if it's only the desire of one person in the clinic to improve advanced access, like you'll work a lot against the wind. I don't know if it's an expression in English, but anyway, so we want to make sure that you have, like, yes, a good chunk of people. Doesn't have to be everyone that is on board and is willing to make some changes, but you have to have like some willingness to change in your clinics in order to hope for improvement. I don't know, Laurie, if you have any other comments to that.
Yeah, I was just going to say that, as Isabel said earlier, this work is a team sport. And so the size of your team is less important than making sure you have the right voices at the table. So anybody who touches this work really does need to be on the team. So whether you had, we would be concerned if there were no admin voices at the table, but the size of the team is not really the indicator for success. And in terms of readiness, one of the things we talk about is sort of those classic things. You need leadership support if there is some, you need some data support, and it doesn't have to mean you need a data person. We can help with that. But there's also that whole, mindset towards improvement. And I think that that's something to consider in this work as you move forward with your applications, is just reflecting on your openness to change, your willingness to change in addition to do the work. We've talked a lot about the ability to do the work when you're busy, but it's also that willingness to make changes as you move forward, because change is hard. We're humans. We don't like to change. But all improvement does require change, and this work is no exception to that. So that would be one of the things that, in terms of readiness, you'd need to consider. There was a question about all of the FOSFIT, FIGs, and CHCs, all of that. If it's team-based care, it's eligible. I think we're not really dividing anything by the funding mechanism. Walk-in clinics would be a different conversation, though, depending on how they're set up, and whether it's team-based, whether it's, I think that one would be, I would suggest, if you are a walk-in clinic, to reach out to HEC and have that conversation.
And there's a question about how can I convince physicians to attend to that in-person meeting. We're going to be providing continued education credits for it in some provinces, and we're like, I don't want to say too much today, but in some provinces, physicians will be able to bill for their time at this meeting, and there's free lunch. So that's definitely a good selling point.
Yep. Okay. And then in terms of the walk-in, I just want to mention, so Milan had put in the chat, very similar to what Lori had said, but with the walk-in model, you need to have attached patients to improve the continuity and access. So that would be something to consider. And again, if you have specific questions about your walk-in clinic model, but you want to know if you're eligible, get in touch. We can speak through your specific scenario. Another question that's come in. So my team has participated in several access improvement initiatives over the past 18 years. How can I sell this as something new? And I'm not, what do you think, Isabel? What would you say to that? And Lori.
That's a good question. I'm not familiar with everything that has been tried over like the country. I know that for Quebec, our formula has never been tried. Like we've seen some training programs, things like that. what we offer to you with the coach is very customized to your setting. So again, no one size fits all solutions. You're in the driver's seat. So I guess that's the novelty that I see from my Quebec perspective and Ontario perspective. But Lori, perhaps you have another point of view.
Yeah, and I think this is sort of what I was getting at a little bit in terms of, willingness, readiness, that mindset for improvement. Sometimes if people have had less positive experiences with QI, absolutely, it will take a little bit more to convince them to get on board. However, I think some of the things we've talked about at the beginning with providers, feeling that as Isabel said, more air in the day, getting out of, the clinic at a reasonable time, being able to feel caught up. Those are the things that, this kind of work can result in. And those are the hooks that we want to, maybe present to your providers. I think it is a challenge. I'm not going to minimize that when people have done QI in the past and maybe not had the greatest experience, of course, they're going to be a little less willing to join. But I think sometimes what is helpful in this program, I think, is the experience that the past programs provide, those lessons learned, create a great opportunity. And I think, sounding really self-serving, but the coaching really, we found when we surveyed people in this kind of work, the coaching can be a secret sauce to actually accelerating this work.
Thanks, Lori and Isabel. So I have two questions in there. So Melissa asked, can this measurement also be utilized for addiction clinics, which see a high volume of homeless and mental health patients? So to be eligible, you'll need to be a team who offers team-based primary care. But if you check that box, then yes, I think, we would welcome that. And Melissa, certainly invite you to just reach out, and maybe I can just reach out to you proactively after this call just to better understand the scenario that you're talking about. But yes, so hopefully that would work. Paula, good to see you. I know you've participated before in some ATC programs. Paula asked, do you need full-time primary care providers at the site? What if we have part-time primary care providers at the site? Could we apply? Yes, you absolutely could apply if you have a team-based, a group of primary care providers, even if some or all are part-time. I think that would be okay. Happy to have a separate conversation with you as well, just to kind of verify, but it should be fine. I see a question that may have been touched on or even answered before. Is the two coaching sessions per month mandatory for each physician? So the answer is no, not necessarily. Physicians will not have to go to all the virtual sessions. In all likelihood, the coach will support the team to have the physicians at some of those coaching sessions, but likely the first in-person session that we have with each team, that will happen most likely in the fall, we would want to have the physicians there, or some of them. And as Isabel had mentioned, we're exploring the team's physicians being able to get credits for attending that 3-hour sessions. We're just working that out. So hopefully that'll be a bit of an incentive. And also you can use the seed funding that's provided through participation to compensate physicians to attend, like portions, like for example, those coaching calls. And then also, are the sessions one-on-one or in group? So again, that's something that you'll figure out with the coach that you're primarily paired with. Sometimes there may be sessions that just the team lead and the evaluation lead attend, but it is very important throughout the duration of the program that your executive sponsor, the person who's going to be able to help remove barriers and create a sustainable initiative, is going to have to be present in some of the discussions to be able to really move things forward. So hopefully that answers those questions. I'm going to go to one more, and then maybe Isabel, Lori, if you see anything else. Does your program take into account the language aspect of patients? Because I think that, for example, healthcare professionals are not very comfortable with patients who speak only in French. So certainly the coaches that we have for the program, several are very comfortable speaking in both French and English. So we have bilingual coaches. So, teams who have staff who speak both, who prefer French, who prefer English, we'll consider all of that when we pair the teams. So from the coaching perspective, you'll be covered with French or English very easily. So yeah, any other questions you see in the chat, Lori or Isabel? We just have a few minutes left for the Q&A. I think that was, otherwise I see one more. So there was one question in there that so it was our primary care teams in Ontario are severely underpaid compared to other health organizations. The mandate is to expand team-based care, and staff are already stretched thin and underpaid. How are we to ask staff to support a program like this, given our current situation? So I could just kind of start off by I don't know. Isabel, maybe I'll turn it to you to see what you think.
Of course, it's not Disney World, but what I can tell, we've coached more than 1,000 physicians in Quebec, and I think there were only 3 physicians that we ended up saying, well, you might have to work a little bit more. And I'm thinking what I have in mind is like someone who has 3,000 patients affiliated under his or her name, but working only like 6 days a month. That is not mathematically sustainable, but most of the people we work with, we work with them so that they work more efficiently, but definitely not more. And this is one of the main outcome that I see from that. Like people, again, we're coming back to that. You're giving me some air. They ended up working almost less at some point, or actually more efficiently. I don't know, Lori, if you can talk from your teams in Ontario.
Yeah, just quickly, I think that it's a really good question and something that you really need to pay attention to. I would ask, is there one provider that would be keen to try this, and then let them be your salesperson a little bit? So that would be something. But I think that your question and reflecting on the ability to take things on is really important. I don't think you can sugarcoat this one and say, yes, this is a magic wand. It absolutely can help. Absolutely, this can make providers' lives better. But I work in Ontario all the time, and I'm aware what you're mentioning, and it's hard. But I really believe in this work, and I think that some real good magic can happen. But it's not the magic wand to fix all of our ills.
Maybe one more comment to that. I've seen many physicians who thought that they were, unbalanced, they were not being able to provide good access. And once they've seen their numbers, they were like, oh my God, it's actually not so bad, so I've seen way more physicians that were positively surprised by the numbers, and then more encouraged to fix a little things here and there so that they could make things look or feel better for their practice. So that's maybe one comment that I had to add on Lori's.
Yeah, and I think that goes back to my earlier comment that it's sometimes the little wee changes for these folks that can make a big difference in their day.
So we hope that we've convinced you to apply for the offering or answered questions to inform your decision to apply. Reach out if you have any questions. I'm going to close things out today but invite you to stick around and watch a short video tutorial that will walk you through HEC's newly launched community portal, which is where you can get in there and start that application. Thank you so much to Isabel and Lori and everyone at HEC behind the scenes helping for this webinar as well. And thanks to everyone for participating. But So whether you're applying to a new program or learning opportunity, the portal will give you an easy way to access and apply for programs. So thanks again to everyone. Take it away to the video.
Welcome to HEC's Community Portal, a secure space where you can apply to and manage your participation in HEC offerings. Let's get started by setting up your account. This will ensure you stay up to date on the latest offerings. As a first step, select Get Started and then Sign Up Now. You'll be prompted to enter and verify your email address. Once you receive the verification code via email, enter the code into the form to complete your registration. From there, you can complete your user profile and you're ready to go. From the home page of the Community Portal, you can explore HEC's current offerings and learning opportunities. To apply or register for an offering, select Enter Here to access HEC's program management platform directly from the portal. Here, you can view and submit applications for active HEC offerings, invite others to collaborate on your application, and manage reporting, including progress and financial reports. On the home page, you'll find a list of active HEC offerings, key program details, important dates, and eligibility requirements. You'll also find helpful guidance on how to navigate the platform and access the information needed. To get started, click on Apply Now in the left-hand menu. From the Apply Now page, click on the Application button for the offering you're interested in. Then complete the appropriate application to register or apply to participate. It's important to remember that the portal does not auto-save. Be sure to regularly click Save or Save and Close at the bottom right corner to avoid losing your work. You can save your application and return to it later, as long as it is submitted before the application deadline. To support the completion of your application, you can invite a team member to collaborate. When completing the team member information, check the box labeled Invite Team Member to Collaborate on this submission. They'll receive an email notification and be granted access to work with you on the application. The email will include a link for your team member to create a user profile in the HEC Community Portal to access the application in the Program Management platform. When your application is complete and you're ready to submit, the Submit button will appear, but only after you've saved and closed the form. Keep in mind, once submitted, you'll no longer be able to make changes to your application. To view all applications you're collaborating on, select All from the drop-down menu at the top left of the screen. After all required information has been submitted, the team lead will receive an email notifying them that their application has been submitted. If HEC staff need more information about your application, the team lead will receive an email outlining what's required. You'll be invited to log in to the program management platform to make edits or provide the additional details requested. The team lead will be notified of the outcome of their application via email after the review process. If your application is successful, you'll be enrolled in the offering. Each offering comes with an established reporting schedule for all participating organizations. To submit a report, go to the Report section in the left-hand menu, then click on Due. Here, you can view your upcoming reports and submit the required data. You can also view previously submitted reports under the Submitted section. If you're enrolled in the Challenge offering, you may be eligible to apply for awards. To apply, go to the Admitted or Awarded section, select your active enrollment, and look for the available award option. If an award is currently open, click the Submit button to complete and send in your award application. Once submitted, the team lead will be notified of the outcome and any next steps following HEC's review. Now that we've walked through the HEC Community Portal and the Program Management Platform, Here are a few key reminders to keep in mind. It's important to remember that the portal does not autosave. Be sure to regularly click Save or Save and Close at the bottom right corner to avoid losing your work. You can save your application at any time and return to it later, as long as it's submitted before the application deadline. When your application is complete and you're ready to submit, the Submit button will appear, but only after you've saved and closed the form. Keep in mind, once submitted, you'll no longer be able to make changes to your application. To view all applications you're collaborating on, select All from the drop-down menu at the top left of the screen. If at any time you need help with the application process, be sure to check out our frequently asked questions and call for applications documents. These resources include valuable details like eligibility requirements, important dates, and guidance to support a successful application.